Hi, I am Dr. Neha Gupta. I work as a senior consultant in the Department of Obstetrics and Gynecology at Medanta Hospital, Gurugram. Now, the best thing is not to have an unplanned pregnancy. The pregnancy should always be a planned one. Whenever you think that as a couple you decide that now we are going to try for a pregnancy, please visit your doctor, your gynecologist. She will take a detailed history and she will elicit all the risk factors which are there already present on the basis of your previous history. This is also the time when she will advise certain blood tests and she will advise you about certain immunizations, that is vaccinations. So by taking the detailed history, by doing all the blood tests, we are able to assess, in how good a health you already are before you embark upon the pregnancy. If any deficiencies are identified, like if your hemoglobin is low, or if by chance we diagnose that the sugars are high, then this is the time when we act upon them and we optimize your health before you actually start trying for a pregnancy. There are certain vaccinations which definitely need to be taken before you conceive. One of them is the rubella vaccine. Now, rubella is a virus which causes a flu-like illness in the adult. Now, if the pregnant lady gets this viral infection in the first 3 months of her pregnancy, the virus travels through the placenta to the baby, and the baby can have some lot of developmental problems and malformations of the brain, eyes and heart, so much so that the pregnancy may even need to be terminated. So rubella is easily preventable by taking a vaccination, so one must take that vaccination before you become pregnant. Then obviously lifestyle is extremely important. Before you become pregnant, please make sure that your weight is in the optimum range. BMI, that is the body mass index, which is basically a relationship of your height and your weight. The ideal range of that BMI is 18 to 25. So you should be in that range. You shouldn't be underweight and you shouldn't be overweight, definitely not obese. So weight has to be optimized before you become pregnant. You have to eat healthy, eat a lot of seasonal fruits and vegetables so that you get plenty of micro minerals, nutrients. You must keep yourself very well hydrated. About 3 liters of liquids should be taken in a day. If there are any addictions, like if you are smoking, then smoking is a complete no-no when you are trying for a pregnancy and even during pregnancy. Alcohol, occasional intake is fine, but binge drinking and very frequent drinking again can have harmful effects and should be given up. Some people are actually addicted to caffeine. So even excessive intake of tea and coffee should be limited to about 200 milligrams in a day. So if you modify your lifestyle, then definitely a lot of problems can be, if not completely eliminated, they can be minimized during the pregnancy. Now, and another very important thing is the intake of folic acid. So folic acid is a type of vitamin B which is essential for the baby's brain and spine development. Now this development of the brain and spine of the baby happens very early in pregnancy. Even within the first 4 to 5 weeks of pregnancy, this thing happens, so much so that you may not even be aware by that time that you are pregnant. So folic acid needs to be taken right when you start trying for a pregnancy, and then it is continued in the first 3 months of pregnancy. The dose of folic acid recommended is 400 micrograms in a day. But if you are obese, if you are a diabetic, if you are on medications for epilepsy, if in the previous pregnancy you've had a child with a neural tube defect, then in all these situations a higher dose of folic acid will be advised, which is 5 milligram per day. And this intake of folic acid, let me tell you, is the single intervention to prevent the recurrence of a neural tube defect in your future pregnancy.